Hello guys, welcome back to Medico Days. So as you all know, our NEETPG 7 years PYQ Q-Bank is ready and it is available at a very nominal price for you all to buy, and the link is there in the description. So now we are continuing with the FMGE Jan 2025 detailed answers PYQ session, and in this video I'll be discussing about the first 50 questions. So the first question is from PSM. Which of the following dosage regimens for adult leprosy treatment kit is incorrect? Answer is rifampicin 450 mg weekly. So rifampicin is dosed at 600 mg once a month for both paucibacillary and multibacillary leprosy in the adult treatment regimen, and the dapsone 100 mg it is used daily for 6 months in paucibacillary leprosy and 12 months in multibacillary leprosy. Clofazimine 50 mg it's a part of multibacillary regimen and daily dose for 12 months is given. And clofazimine 300 mg monthly, it is monthly supervised dose for multibacillary leprosy. So next question from Micro. An HIV patient presented with bouts of cough and fever. What is the selective medium used for microbiological investigation? Answer is LJ media. So LJ media is a selective and enriched media specifically designed for isolating Mycobacterium TB. And malachite green in its composition inhibits the growth of contaminating bacteria, making it selective for mycobacteria. The key components which support the slow growth are the glycerol, egg, L-asparagine, mineral salts, and they also support the metabolic needs of Mycobacterium TB. And colonies, they appear dry, rough, raised, irregular, buff colored, and are difficult to emulsify. Next question is from Pharma. A patient with paracetamol poisoning is treated with N-acetylcysteine. What is the primary mechanism by which N-acetylcysteine prevents toxicity? Answer is it replenishes the glutathione levels. So paracetamol is metabolized by the CYP2E1 to N-acetyl para-benzoquinoamine, that is NAPQI, a toxic metabolite. So normally glutathione conjugates with NAPQI, detoxifying it for urinary excretion. So toxicity occurs when glutathione reserves are depleted, allowing NAPQI to bind hepatocyte macromolecules and cause hepatocyte necrosis. N-acetylcysteine prevents the toxicity primarily by replenishing the glutathione stores, enabling the detoxification of NAPQI. It also directly conjugates with NAPQI, reducing the oxidative damage. Next question is from Micro. A zinc smear from a vesicle shows multinucleated giant cells. Which virus is responsible? Answer is herpes simplex virus. So multinucleated giant cells, that is the zinc cells, they are a hallmark of herpes virus infections, and it is characterized by faceted nuclei and homogeneously stained ground glass chromatin. So HSV causes vesicular lesions where these cells appear due to viral induced cytopathic effects which trigger the cell fusion. Zinc smear is a rapid sensitive diagnostic tool for HSV using the orthotoluidine blue staining of the scrapings from the base of the vesicles. Next question. On which dates is National Deworming Day observed in India? Answer is 10th February and 10th August. So National Deworming Day is observed twice yearly on February 10th and August 10th to reduce the intestinal worm infections among children aged between 1 to 19 years. And the initiative involves mass administration of albendazole, an antihelminthic drug, through school health workers and community outreach programs, and these dates align with the school terms to maximize the coverage, targeting the nutritional improvement and preventing anemia or growth delays linked to the parasitic worms. Next question is from Patho. In which neoplasm is the CMYC gene mutation characteristically observed? Answer is Burkitt's lymphoma. This question, again, these genetic mutations are very important. They keep coming up in most of the competitive exams, so please learn more about that. Burkitt's lymphoma is defined by a translocation involving the CMYC gene, commonly the T14, leading to dysregulated MYC protein expression and uncontrolled cell proliferation. Histopath shows a starry skies pattern and cells with royal blue cytoplasmic vacuoles on bone marrow aspiration. 3 clinical forms exist. One is the endemic African one, which presents with mandible or abdominal mass, and second one is the sporadic one, which presents with ileocecal or peritoneal involvement, and third one is the immunodeficiency associated, which presents with aggressive lymphoma or leukemia. Next question from Pharma. A patient with penicillin allergy presents with fever, burning micturition, ototoxicity and dizziness. Which drug is most appropriate for management? Answer is ciprofloxacin. It is a fluoroquinolone which works by inhibiting the bacterial DNA replication. It inhibits 2 essential enzymes, the DNA gyrase and the topoisomerase 4 of the bacteria. And DNA gyrase, it relieves the supercoils and helps with DNA replication, and topoisomerase 4, it prevents the chromosome segregation. So it is effective against common uropathogens and achieves high urinary concentrations, making it ideal for UTI. And it is a preferred choice in penicillin allergic patients because it has relatively safe profile in such individuals. Next is a question from Patho. A patient underwent cholecystectomy and black pigmented gallstones were noticed. What is the least likely cause? Answer is HBD Punjab, because pigmented gallstones are primarily associated with chronic hemolytic anemias because of the increased bilirubin from the ongoing hemolysis. So sickle cell anemia, HBH disease and beta thalassemia minor are all hemolytic disorders and are thus commonly they can lead to black pigment stones. HBD Punjab is a non-hemolytic hemoglobin variant, also called hemoglobin D Los Angeles, resulting from a point mutation in the beta globin gene. Next question from Physio. Which segment of the nephron has the lowest osmolality in the absence of ADH? This answer to this question is cortical collecting duct. In the absence of ADH, the cortical collecting duct is impermeable to water. So sodium and chloride are reabsorbed without water, further diluting the tubular fluid to 50 to 75 milliosmoles per liter, the lowest osmolality in the nephron. This occurs after the solute reabsorption in the water impermeable ascending limb of loop of Henle, which dilutes filtrate to 100 milliosmoles per liter. Next question from surgery. A 30-year-old female presents with painless, rapidly growing breast lump. Examination reveals a well-defined mobile firm mass. Ultrasound shows a solid lesion and biopsy histology demonstrates a leaf-like pattern with stromal overgrowth and ductal structures. What is the diagnosis? So again, this leaf-like pattern here is the catch-hold point and that points towards the Phyllodes tumor. So very important. And this question is also related to pathology as well because the biopsy histology of leaf-like pattern can be related to patho aspect of this question. So leaf-like architecture with stromal hypercellularity and overgrowth is pathognomonic for Phyllodes tumor, a fibroepithelial neoplasm arising from the intralobular stroma. And clinical features are rapid growth, well-defined mobility and occurrence in younger women, though typical in more than 40 years. And key histological differentiator from fibroadenoma is that the stromal overgrowth, peripheral stromal accentuation and the potential for malignant transformation. Next question from Micro. A group of 20 students in a hostel ate fried rice for dinner and developed severe vomiting 6 hours later. Which organism is most likely responsible? Answer is Bacillus cereus. So incubation period of 6 hours aligns perfectly with the emetic type of Bacillus cereus food poisoning. And fried rice is a classical vehicle for Bacillus cereus because of the heat-resistant spores that survive cooking. If left unrefrigerated, the spores germinate and they produce heat-stable toxin. So vomiting is a hallmark symptom of the emetic form consistent in this case. Next question from PSM. A government pasted public awareness poster in the public places. What type of communication method does this represent? Answer is mass approach. So mass approach involves disseminating information to a large heterogeneous population through impersonal channels like posters, TV, radio, social media. It is characterized by one-way communication, broad reach to influence public awareness on social or health issues, and the use of standardized messages for population level education. Posters in public places exemplify this method as they target the anonymous crowds efficiently. Next question from Patho. A 40-year-old man with Huntington's chorea has a family history of the disease. Which phenomenon best explains the earlier onset of symptoms in successive generations? So answer here is genetic anticipation. Again, this trinucleotide repeat disease is a very important topic, very important. Please read about the trinucleotide repeat disorders. So genetic anticipation is the key mechanism in this question. So it is caused by expansion of the trinucleotide repeat CAG in the Huntington's gene on chromosome 4 across generations. Successive generations inherit more repeats, leading to earlier onset and increased severity of symptoms like the chorea and dementia, and characteristic of autosomal dominant trinucleotide repeat disorders like Huntington's chorea. Next is a question from Patho. Identify the cell marked in the histological image of the cerebellum. Answer is Purkinje cell. They are large flask-shaped neurons arranged in a single layer between the molecular layer outer and the granular layer inner of the cerebellar cortex. Next question from Micro. A patient tests positive for HBsAg, HBeAg and IgM anti-HBC. What is the status of the patient's condition? Answer is acute hepatitis B. It is confirmed by the triad of positive markers like the HBsAg, HBeAg and the IgM anti-HBC. So again, hepatitis B is a very important topic and the markers are also very important. There's also a graph which is available most of the rapid revision platforms. Please go through that. Very important, hepatitis B. Next question, a patient pricked by a rose thorn develops multiple vesicles on hand and eruptions along the lymphatics. Most likely causative agent is Sporothrix shinki. It causes lymphocutaneous sporotrichosis characterized by traumatic inoculation. Example, the thorn prick introducing the fungus into the skin. So other diseases are histoplasmosis, which is also known as Darling's disease. Sporotrichosis is known as the rose thorn or rose gardener's disease. Paracoccidioidomycosis is the South American blastomycosis. Coccidioidomycosis is also known as desert rheumatism or valley fever, and blastomycosis is known as North American blastomycosis or the Gilchrist disease. Next question from Derma. A 4-month-old child presents with abdominal lesion, clinically significant with the infantile hemangioma. What is the appropriate management? Answer is observation. So infantile hemangioma are benign vascular tumors with a natural history of spontaneous involvement, and there's a proliferative phase and involution phase. Proliferative phase, the growth peaks by age 6 to 12 months, and involution phase begins by age 1 to 5 years, with 50% resolving by age 5 and 70% by age 7. Complete regression typically occurs by age 10 without intervention. So observation is the standard approach for uncomplicated hemangioma because of the high rate of self-resolution and minimal scarring. Next question from OBG. All of the following drugs can be used in the treatment of hypertension in pregnancy except. Answer is enalapril. Again, the management of diabetes in pregnancy, management of hypertension in pregnancy, all these are very, very important topics. Please learn more about them. Next question is from Biochem. A chronic alcoholic patient presents with gum bleeding, corkscrew hair, petechial hemorrhages, poor wound healing, and generalized weakness. Which vitamin deficiency is most likely responsible? Answer is vitamin C deficiency. Again, vitamins is the most scoring area in biochemistry. A lot of questions keep coming up from vitamins, and that chapter is very, very important. Here the answer is vitamin C deficiency. That is scurvy, which explains the features mentioned here. Impaired collagen synthesis disrupts the connective tissue integrity, causing gum bleeding, petechiae, and poor wound healing. Corkscrew hair results from the defective keratin cross-linking because of the disrupted disulfide bonds, and generalized weakness arises from the anemia and defective energy metabolism. Chronic alcoholism is a key risk factor because of the malnutrition and the reduced dietary intake of vitamin C rich foods. So this is a small table which provides a brief idea about the vitamins and their deficiency states. Next question from Patho. A 55-year-old female with persistent headache has a CT scan revealing a brain tumor. Histopath shows samoma bodies. What is the likely diagnosis? Again, conditions where samoma bodies are found. It's a homework for you guys. Please learn about it. Very, very important, samoma bodies. So here the answer is meningioma. It is confirmed by the samoma bodies, which appears as concentric laminated calcifications on histopathology, a hallmark feature. So please look upon the image of samoma body and also the conditions where they are seen. And I have provided a table with the pathological named bodies and found in which all conditions. Please go through this as well. Very important. So next question from Physio. Which of the following cells is responsible for the removal of small foreign body particles trapped in the lungs? Answer is dust cells. So they are specially phagocytic cells derived from the bone marrow monocytes. They migrate to the alveoli and engulf small foreign particles that bypass the mucociliary escalator. These macrophages also secrete chemotactic factors to recruit immune cells and stimulate the hematopoiesis. Next question from Patho. When is the optimal time to use TTC, that is triphenyl tetrasodium chloride staining, during autopsy for visualizing myocardial necrosis in a recent infarction? Answer is 2 to 3 hours. So TTC staining relies on detecting the LDH activity in the viable tissue. Intact myocardium reduces the TTC to a brick red formazan pigment. Necrotic cells leak dehydrogenases due to membrane damage, leaving the infarcted areas unstained, that is pale. The 2 to 3 hour window post-infarction allows sufficient time for enzyme leakage from necrotic cells, maximizing the contrast between pale infarcts and red viable tissue. Next question from Biochem. A firefighter sustains electrical burns and presents with tea-colored urine. Which finding is most likely on urine analysis? Answer is myoglobin. So electrical burns cause tetanic muscle contractions leading to rhabdomyolysis, that is skeletal muscle breakdown. This releases the myoglobin into the bloodstream, which is filtered by the kidneys and appears as tea-colored urine. Myoglobinuria directly damages the renal tubules via heme toxicity and causes tubular obstruction by pigmented gas and induces renal vasoconstriction, risking acute kidney injury. Next question from PSM. Which vaccine is contraindicated during pregnancy? Answer is varicella vaccine. It's a live attenuated vaccine, and live vaccines pose a theoretical risk of fetal transmission because of the potential viral replication, making them contraindicated in pregnancy. Next question is from Micro. A firefighter presents with fever, cough, and lung consolidation. Microbiological testing reveals a gram-negative oxidase-positive organism. Culture shows colonies that exhibit trans-illumination under light. Most likely causative agent is answer Pseudomonas aeruginosa. It is a gram-negative oxidase-positive bacillus, and its colonies produce pyoverdin, a fluorescent siderophore pigment, causing greenish-yellow fluorescence. That is trans-illumination under the UV light. This aligns with the microbiological findings. It commonly causes pneumonia in immunocompromised individuals or those with occupational exposures, example firefighters inhaling contaminated water or soil. The remaining questions I'll be discussing in my upcoming video. So till then, stay tuned. And if you guys are interested to buy my NEETPG PYQ book, then please check out the description. So till I come back with my new video, bye.